Hello, 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 and welcome to today's presentation on resume and cover letters for medical coders and billers. My name is Dartina Dunlap. I am a career counselor in the Office of Career Services at Governor State University, where I have been working with students, alumni, and community members in the area of professional development for the last 10 plus years. And I am so excited to be able to work with you guys today on how to build effective resumes and cover letters. So we are going to go ahead and jump into the presentation. What I would like to see first is I want to make sure that everybody can hear me. I have a slight cold today, but just make sure that everybody can hear me. If you can hear me, just kind of like give me a thumbs up or, put it in the chat feature so that I know that you're able to hear me very clearly. Okay. So we're going to go ahead and we're going to move on to the presentations. The difference between medical coders and medical billing. And so a lot of times you will hear these terms kind of used, kind of combined, like medical coders and billing. And sometimes there are people who are focusing on the coding and there are others who are focusing on the billing. So they are two separate entities, but oftentimes are found in the same place. And sometimes they have duties that are similar or the same, but they are different. So just to begin with the descriptions of what they do, we're going to go with medical coders. Medical coders look at the patient's records to determine what procedures were performed by the doctor, the surgeon, the nurse, and the rest of the healthcare team. They would then place the correct procedure code or diagnosis code, hence the word coders, for the corresponding services obtained by the patient. Okay, so they are uniquely coding the various procedures that are taking place. Then you have medical billing. Medical billing, on the other hand, is concerned with entering the codes into software and processing insurance claims. So they take it to the next level, which is processing insurance claims. Medical billers make use of special billing software, right? Which allows them to input the codes assigned by the coder as well as other insurance information so that the insurance claim may be sent to the insurer in order for payment to be facilitated. So a lot of times is why you hear the medical coder and billing, because there are people who do both. Then there are billers who are expected to know the claims process and the requirements that have to be submitted to the process claims because they deal with payment processes. And so I thought that was really, really important to really just identify the differences between the two because, I'm sorry, make sure your mics are off. Thank you. Just to make sure you have a full understanding of medical coding and medical billing. So one of the biggest questions that I often get asked, no matter what type of resume I'm helping someone to create, is they usually want to know, should they use a template? So should I use a template? Well, we encourage them in the Office of Career Services not to use a template. And there are many reasons why we go this route. The biggest one is that templates usually, they hold to a certain set of principles. And so when those principles are set, it can become increasingly hard to make changes in your document. So we encourage people not to do it. That's one of the reasons. The other reason is you don't want your resume to just fall into a pile of resumes that it looks like. So it helps it helps you to be more unique when you actually create your own. But now I always list some pros and cons because not everyone feel the same way. And sometimes you will have people who will choose to still use a template. So some of the pros of using a template is it's easier just to plug in your information. You don't have to guess where stuff go, where text go. You just plug the information in. So it automatically has structure, and the formatting is already present, is ingrained in the document. The layout allows you to present information in bite-sized chunks, which increases the legibility of it, makes it easier to read, easier to find the information. However, these are still things that you can do when you create your own as well. So some of the cons: it appears the candidate took the easy way out when creating their document just by plugging in their information. It becomes the same as everyone else's resume. Like I said, it's just part of a pile of resumes, and you don't want it to be that way. The candidate, it looks like the candidate didn't invest the necessary time to tailor their resume for the position, and you don't want yours to fall into that category. A lot of templates are substandard, so they're not up to par. And you really want to make sure that your resume doesn't fall into that category. And then last but not least, many times it becomes harder, as I said before, to add or reorganize information, up-to-date information. You do not know how taxing that can be on you when you're trying to make changes in a hurry. Maybe there's an opportunity that you want to apply for, and you need to make a few changes on your resume by updating it. And when you're not able to do that, it can become very, very frustrating. I get a lot of people calling me with that actual problem. So when it comes to creating an effective resume and cover letter, especially when we're talking about the resume, the question often becomes, how should I organize my resume? This is a big, big question. It's something that I get asked a lot, and it's really important that you do arrange your resume in a manner that is effective for you in obtaining a job position and or applying for a program where they want to see your work history. You want to make sure that you simply arrange your sections by order of relevance. So these are a few questions that you should ask yourself. Which is stronger, my education or my work experiences? And whichever is stronger, that is what you will put at the top of your resume. So if your education is stronger, your education will go at the top. If your experience is stronger, it will go at the top. And so the one way to determine that is to think about how much experience do I have in this field and or that's related to this work. How much relevant work experience do I need to communicate through my actual resume? You want to make sure that you list those things out. Even if you have to get you a separate sheet and just identify the things that you've done that's related to your experience or the field that you're going into. So you will have sections like your volunteer work. I say don't discount any experience you have, whether it's volunteerism, whether it's community involvement, whether it's travel abroad, study abroad, whatever it is, don't discount it. A lot of times, the only thing that you want to demonstrate is that you have experience and you've utilized some of the skills that are necessary in the field that you're going into. And in this case, you're going into medical billing and coding. And so you would want to make sure that any type of health experience, medical, biology, anything that you've had that relates to that field, that it is actually on your document. And as we move forward in this presentation, we are going to talk about some of those transferable skills, but we're also going to talk about some of the skill sets that are needed, particularly in this field. So getting started, what do I include? Well, in your first section, please turn off your mics. In your first section, your contact information, be sure to include your name, your address and phone, your email, your LinkedIn address. There are sometimes where leaving off the exact address is okay. You can actually then put the city and state if you choose to, because I do realize you're going to be applying on some internet forms, and you want to make sure that you're not putting your exact location. That makes sense. However, I'm going to strongly encourage you, if you identify a place that you want to work at, you want to go straight to their website if you're able to apply for the position that way. Then in your education section, you're going to include your schools, community colleges, technical schools, certifications. You're going to put the location of those places, which include the city and the state. If in the event that you are working towards a degree, you would put it on there, but you could put your anticipated date of graduation. If you're not, that is fine too. You want to go to the most recent education that you have. Even if that includes maybe you haven't had any college yet. That would be the only time that you would put your high school on the actual resume. So if you graduated and had a high GPA, or you were in the honors program, you want to make sure those are things that you include on your resume as well, because it demonstrates that you have strong work ethic. And so that translates over into you being a person who has great work ethic. And so we want to make sure that we record that on our resumes. Then you have your experience section. So you're going to put the companies and the organizations that you worked with. So their names, location always include the city and state, your titles, the date of employment or involvement, descriptions of responsibilities, so their duties, achievements, etc. So what you're going to do, and we're going to talk about that in a few more slides, is you're going to describe your experience, but there's a formula that you're going to use. And I'm going to show you how to do it. You want to make sure that you use action verbs to describe your duties. Make sure that you're not redundant. So if you have job titles that are similar, instead of stating all the duties that you did and then repeating all of those same duties, you can go and you can expand on different duties so that you're showing or demonstrating a wide range of skills. You want to show them what you have done and what you're capable of. You're always thinking in terms of transferable skills. You want to make sure that you select content that supports your qualifications and matches the job description. So here are some things to think about when you are deciding what should go on your resume as a medical biller or coder. What have you done already that aligns with the description of the position? So remember, we're going to go back to those terms of what each one means. And when you are applying for the position, you're still going to look in their description bar. I always say go into the description section, and you're going to identify all the things in that section that you have previously done. And once you check those off, you're going to make sure you go to your resume and that you include it in your resume if it is not there. Now, you're not going to copy and paste exactly what it states, but you're going to talk about whatever that skill section is. So for instance, if it says have strong communication skills, then you would go into your resume in any place where you can demonstrate communication skills, you're going to make sure that you've done that. If you're going into billing, you're going to go into your resume, and any job where you have been responsible for the billing aspect of working with patients and or clients, you're going to make sure that that is outlined on your resume. That's going to be huge, and it's going to be important. You want to make sure that you are really sticking with those things that align with medical billing and coding. Now, you're going to look at the experience that you have that's most related to it, like I stated before. How old is the information? You know, that's really important as well. We usually say you can go back 10 to 15 years on your resume. We do understand that as you're going into this profession and it's a new field for you, you may not actually have as much experience in that field, but there may be some things that you've done for another organization that kind of mirrors the description that is needed for this position. And maybe it's 16 or 17 years old, then you can go back and you can add that to your resume. But you really don't want to go back that far if you don't have to. However, I think one of the most important things that you can do, especially as a new professional in this particular field, you want to look at the skills that are utilized, that you've utilized, that are transferable skills that are needed for people who are working in these areas. And some of those skills that are utilized, they include, again, communication skills, active listening, problem-solving skills, conflict management, attention to detail, organization skills, time management, and multitasking. At this time, just a quick check-in. Do I have any questions thus far? No? Okay. We're going to keep moving. So earlier, I talked to you guys about the descriptions, and your descriptions, you know, they're going to be outlined on your resume in a bullet format. Now, I know that there are resumes that will have it in the paragraph style, but I strongly encourage you to use bullets. The reason that we do this is because when you are utilizing the bullet format, the information stands out. Is easier to read for prospective employers. And you want to make sure that they're able to retrieve this information really quick. So you're going to make sure that you're putting your descriptions in a bullet format. But there are a couple of rules that we want you to follow when you are creating these bullets for the actual description sections of the jobs that you've had and or the experience, because not all experience is paid experience. And so you want to take an action word. Now, we actually, in our office, we have a list of words on our resume guide, which you can utilize to start your bullets with. We always say you want to start with an action word. And then you want to take the journalistic approach. What is the journalistic approach, Dartina? Well, it is when you answer a few questions in one bullet. So you can tell what you did, who you did it for, why you did it, under what circumstances you did it, or how you did it. If you answer at least 2 questions, you are being descriptive in your bullet. Sometimes you will actually be able to answer 3, but it's imperative that you make sure you answer some of those questions. I have here a list of action words. So I just talked about them, but I still wanted to actually include them on the presentation because I thought that it was important. Now, this is not an exhaustive list, but it is just a few of them to kind of give you an idea of the verbiage that you would use. It's also important not only to use the action-oriented verbs to start your bullets with, but it's also going to be important that you integrate the verbiage in your field. So you want to use the language specific to the world of medical billing and coding. And I'm going to talk about that in the next couple of slides. But here is just a list of the action words that you can use to just start your bullet with. Now, this is how you develop your descriptions. As I've told you, the questions that you needed to ask yourself by taking the journalistic approach. So you see, you have like 6 different questions that you can answer within your bullet. And what I mean by that, you're not going to answer all of the questions, but you remember, you only want to answer two of those questions. Every blue moon, you'll get 3 in, but you also want to make sure that your descriptions aren't too long, because that's going to be really, really important. So I'm going to give you an example of what this looked like, and then I'm just going to ask you to kind of follow along with me, and maybe somebody will attempt to actually, you know, create one themselves based on what I'm showing you right now. So an example would be if a person wrote on their resume, they document patient data. Now, some people might say, well, that's, you know, that's a bullet to me because I want to keep it short and simple. So we're not discouraging you and saying, you know, that it needs to be simple. However, we're saying that it needs to be full of the necessary information that an employer could pull out really quick. And it needs to look as though you actually put the time in to describe the actual experience. So the way that a professional might say that same thing, document patient data, would be document patient data and medical records to comply with insurance company requirements. So document patient data and medical records. That's what you do. Why do you do it? To comply with insurance company requirements. So you see how I was able to answer 2 questions from that journalistic approach. Do I have anyone who might be willing to try it themselves? No? Okay. So I have quite a bunch here tonight. Okay, so I was talking to you a few minutes ago about using field-specific language, and I thought it was worth incorporating it in the presentation so that you can get an idea of what I mean by that. So here are some terms that are used in this particular field and are very important. And at the bottom of the slide, I have samples of more bullet descriptions that you can actually implement on your resume using the formula that I just completed a slide ago. So you have benefits, and of course that's to the extent to which your coverage will pay for services provided to you. Benefits may describe what portion of the allowed amount may be due from you, the level to which they will pay for services provided by various providers, and what types of services they will or will not cover. A bill invoice statement is a printed summary of your medical bill. So when I say implement field-specific language, if you're implementing the word benefits, if you're implementing bill invoice or statements, brand name drug, all of those are very specific, it's very specific language that is in your field and that someone else, an employer, would be able to identify and relate that to the work that you would be doing as a medical coder and or biller. So some resume sample descriptions would be review bills to review bills to ensure accuracy and liaison with Medicaid and private insurance companies to resolve discrepancies. So it's telling what you would do, and it's telling why you're doing it. And then the next one would be investigate parameters of coverage and ensure services rendered are within those guidelines. So it told what you did and why you did it again. I have a tendency myself to answer the questions what I did and why I did it. Sometimes who I did it. But again, remember, you can choose to answer any of those questions from the journalistic approach. But no matter what, you want to make sure that you include your field specific language. So the words like claim, claim number, Centers for Medicare and Medicaid, and then you have the acronym in there, which means that if you're going to be using the acronym in your resume, after you write the word the first time, you want to put the acronym in parentheses. That's really important. The first time that you refer to it in your resume, you're going to put the acronym behind it, so that when you use that acronym in any other spot on your resume, that the reader knows what you're talking about. And in this particular field, the employers are going to know. However, it's just the proper way to format your resume and cover letter. You got co-insurance and certification number. In a resume, for a resume example, the description could be: you gather information from healthcare providers to assign the correct medical code and plan. So that would be a huge part of what you do. You gather information. Who do you gather this information from? You gather information from healthcare providers. Now, why do you do this? To assign the correct medical code and plan. In this specific bullet, you're actually answering 3 of the questions, which is great because you see that it's not a really long bullet. However, it does cover the areas that it is intended on covering, so that it meets the criteria of being a journalistic approach response. So now you have coordination of benefits, cover benefit, HIPAA. HIPAA is definitely field-specific language, and you will see it utilized often in the positions of medical billing and coder. Hospital-based billing, and the resume sample would be explain HIPAA requirements to patients during their medical visits. Now, you may actually be working in an environment, healthcare environment, where you're doing that already. Maybe that's just something that you've been trying to do, just that aspect of it. You definitely want to make sure that you include that on your resume, because it is directly related to medical coding and billing. And so you want to make sure that they have an understanding that you understand and comprehend HIPAA, the requirements, and that you're able to articulate that to patients and or clients. That's really, really huge, and it's really, really important. And again, it's going to mean that you're including the field-specific language. Now, I actually just, utilized a lot of the description examples that I researched and wanted to demonstrate to you how you would actually outline them on your resume. So I'm just gonna kind of go through these few bullets. Manage chart completion, and then you notice in parentheses I have the coding. Chart assembly and analysis, and patient information, private and security. Just private and security, just meaning, the 2 words, but the slash stating the 2 of those. It can be either or. Use EMR software to manage patient records and files, reinforce and uphold patient confidentiality as required by HIPAA and the clinic. Manage chart completion, again, the coding in parentheses. Chart assembly, analysis, patient admission, and patient information, again, privacy and security. Review coding and verify the diagnosis codes and procedure codes and are congruent and clinically appropriate. Then last but not least, interpret and review medical record documentation to assign accurate CPT for procedures and assign ICD-9 diagnosis code. All of this is terminology that is already used in the field. So it's expected that if you've not had a lot of experience, you will not be able to be this detailed. However, if you have had some experiences because you have worked in a health environment, maybe you have been a CNA, and you have worked very closely with the person who does the medical coding in your facility. That person maybe has mentoring you or just showing you some ins and outs and are allowing you to take on any of those duties or allowing you to support them. Then you want to make sure that you are actually adding that to your resume and cover letter, especially your cover letter, because you're able to use that. And when we get to that, I'll kind of read an example of a cover letter and for a person who is just kind of starting out but have had some experience in a healthcare facility, such as CNA worker. And so you will get a chance to see exactly what it is I'm stating and how you can begin to articulate that. Here's an example of a resume with the person's qualifications on it, some accomplishments they've made, some experience that they've had. Now, again, this may be a person who has more experience than you do. However, remember, in those spots where your job title is not matching theirs, but you are working in a healthcare facility, it's also related to the work that you're doing. And that's part of the reason why I also say be sure to include field-specific language and also looking at transferable skills. A lot of times what I will encourage people to do, especially when they're new in a field, is to make sure that they put the skill set on the actual document. So for instance, under Mercy Medical Center, instead of going into the bullets, maybe the marketing word there might be communication. And then you will put all the bullets related to communication. And then up under communication, there may be a second word that you choose. It could be possibly problem solving. And then you could put up all the bullets that actually fall under problem solving. That's if you don't have the direct experience in the field already, and you're trying to get that experience. One of the things that you could do is you could also put your certification. If you wanted to put some of the courses that you completed to get that certification, you could actually bullet that out under the certification portion of your resume. So don't be discouraged if you don't have a lot of experience in this field. It's expected when you're new in the field that you won't have a lot of experience in that field. However, if you have a great resume, great document that outline your transferable skills or describe your strong work ethic or your passion for doing the work, and your passion will come across in your actual cover letter. So don't be dismayed, just be encouraged, move forward. Be sure to stick to some of these principles that I have described already. And here are a few tidbits in relation to the resume. You want to use white or off-white resume quality paper. In this day and age, though, many companies and organizations are making it a requirement to actually attach a resume. But we always put it on there just in case there is an incident where you actually have to give your resume to a prospective employer, remembering that you should only type on one side of, your text should only be on one side of the actual document, that the fonts should be anywhere from 10 to 12 points with a margin of 1 inch on the top and the bottom. In some instances, when you have to expand it, then you can actually go to like a 0.75 and on the sides, just so that you can widen it out, and that's totally acceptable. Use non-decorative typefaces. Be sure to stick to it. So you're going to use fonts like Calibri, Arial, Times Roman. You want to avoid italics, bolds, and underline words. So it doesn't mean that you can't have them, but you don't want to have a resume that have all of it. Have italics, it's bold, it's underlined. It can be really busy, and that might deter the reader from actually taking the time to sift through your resume. You have to remember that a lot of organizations don't have a lot of time to actually look at your resume. They have just a few seconds that they give to your resume, especially if they have a whole lot of resumes to go through. Some have software systems that will automatically eliminate certain things, certain resumes. And so you want to make sure that you are following as many of the principles as possible so that your document rises to the top of the pile, especially with you using those verbs and language that's specific for your field. Those are things that will get you to the top of the pile. You know, I'm going to say this, but not many of us are mailing, our resume anymore. But in the event you find yourself doing that, be sure to just put it in a large envelope. Do not bend. You want it to be crisp. So you want to make sure that you put it in a large resume. Now, how important, before I move to cover letters, are there any questions related to resumes? Anything at all? No questions? Okay. All righty. With that being said, I'm going to move on to cover letters. Guess what? We absolutely should have more than one cover letter. So what do I mean by that? You're going to have one cover letter per job that you are applying for. You should always have a cover letter, whether you believe they read them or not. However, do not just do one general cover letter and send it out to a lot of different organizations. You want to make sure that there might be some things in there that you utilize in each resume, and each cover letter, and that's fine. However, you want to make sure that you make it specifically for that company and organization. So when you are speaking to them through that cover letter, you're identifying the person that you're supposed to be sending it to, and or human resources. You may possibly integrate, you will integrate their information, the company organization, their address, you know, any specific information to that position. And you want to make sure that you're making it unique for that company and organization. Now, while you may be applying for medical billing and coding, and that's standard, you want to be able to retrieve or pull something out about that particular company and organization that resonates with you when you do your research. And you're going to do a little research. It's nothing really deep, but it is something that will help you to understand the organization better. And it may actually help you to formulate your questions that you have for them, permitted you are given an interview, because we all know that you should have questions when the interviewer asks you, are there any questions? It just helps you to appear interested and motivated. And those are things that you really want to articulate in an interview. So please make sure that you are creating a cover letter that is specific to the organization that you are actually applying for. What is the purpose of the cover letter? Well, it does a couple of things. It introduces you and your resume to the employer. It states the position you are applying for. It details why you are a good match for the organization and or position. And last but not least, it provides a sample of your written communication skills. All of these things are really, really important. There is actually a formula when it comes to creating a resume and cover letter. The first, you will have 3 to 4 paragraphs. In this instance, you will more than likely have 3 because you don't have as much experience just yet. So you will only have 3 paragraphs. And the first paragraph will be your opening paragraph, which would be just you stating your purpose for writing and applying what position that you're applying for. You could also list anyone at the company or organization that has referred you to the position. But if you do that, please be sure that you've spoken with that person and that you have their permission to do so. Then in the second paragraph, which is the body of your letter, you're going to highlight qualifications and experiences. You're going to sell yourself as a competent and committed professional. In this paragraph, I'm going to say, if you're only doing 3 paragraphs, you also want to include there something about that organization and how it aligns with what you want to be doing and why. And so, for instance, as a counselor, one of the things that we will pull out really quickly is their philosophy or their mission statement. And it may say something like, according to your mission statement, it states the following: I too hold this to be true for myself and have embodied these principles by the following. So you may not pull out that mission statement, but it may be something else unique about that organization that you want to identify on your actual cover letter and how you are connected with whatever that objective is. It helps them to see how you fit into the culture of the organization, and that's really important. Then finally, that closing paragraph, the first thing you should do is point you to the next step. So I look forward to interviewing with you to further discuss my skills and qualifications. That's huge and that's really important. But even before that, you can even start the paragraph out by saying, again, I'm very interested in the position of, and you can state medical colon and billing, or medical colon or medical billing. What you're going to do is you're going to reiterate whatever position that you had in the first paragraph. And then you're going to point to the next step, which is really important. So I took the time out to kind of create one so that you could see what it looked like, and also try to give you some ideas on the language, how I'm integrating the language in there as well. But most importantly, I wanted you to just see the layout, because a lot of times I see people do this and they don't have like the correct layout. And this is showing you like how you have the person's information on here. And why it's important. Dear Ms. Jetson, I'm very excited to apply for the medical billing position on your website. I earned my certification for medical billing in January 2022. I believe with my certification and years of experience in the healthcare environment, I would make an ideal candidate for this position. Working in the healthcare field for the last 5 years as a certified nursing assistant has helped me to understand the unique process of medical billing and coding. While much of my past work has been physical, I have developed a keen sense of billing as I have often engaged with others who are responsible for billing and coding. So much so that I decided to pursue my certification in this field. Gaining my certification as well as the unofficial mentoring from other medical billers and coders has equipped me with extraordinary skills that will be advantageous in this role. Some of my transferable skills include, but are not limited to, problem solving, organization, communication, and detail oriented. Again, I am very interested in the medical billing position. I look forward to meeting with you and discussing my qualifications in more detail. I can be reached by phone at 708-235-7347. Thank you in advance. And then, of course, I sign off. So that was just to give you an idea of what the cover letter would actually look like. So with that being said, I'm going to ask, are there any questions at this time? I feel like I've just been talking at you, and I want to get a little bit of feedback from some of you guys.
You've been talking very, very good, Ms. Dunlap. I mean, it's on point, but I want to give our clients or students to have an opportunity to ask a question, and I'll make a comment I want to ask you about. Come on, I know we got about 4 students on this class. I think there was Carolina. I'm not looking at the attendance slip, but anybody, any comment? Comments are free.
Just anything that you're curious about
Right.
when you think about creating your own resume and cover letter. And I also want to throw this out. If you are creating a resume and cover letter and you're just not sure, you are welcome to reach out to me and I will help you, give you some pointers on what it is you should be doing for your resume, and just helping in any shape or form that I can. And with that being said, you can actually reach out to me through email, ddunlap@govst.edu. And just let me know that you were in this presentation and that you are currently working on your resume and you would like to meet so that we could go over it. And we can go over it. We can even do a virtual meeting through Zoom. But again, are there any questions?
I think we got something in the chat, do we not?
Yeah. Thank you, Gina.
Yay, Gina. Any questions in the chat? If
You're
not,
welcome, Johanna.
yeah, could I ask a question or comment?
Absolutely.
Okay, I was taking notes. You are fabulous. You are fantastic.
Thank
And
you.
audience, I want you to know, normally, wait a minute, there's something in the chat. Is there something in the chat regarding a question or no?
Let's see. No, they're just saying thank you.
Oh, okay. But I just want to say that to our participants, you all are so fortunate. You know how much, well, anyway, I made career changes in the last 2 years, and everything that our instructor is sharing with you, she is on point. She has not missed a beat. And the one comment I want to make, really two, I understand that some of the employers rather, are now using machines like to screen certain resumes, cover letters. What do you
Yes, they
recommend in
are.
that case? What do you recommend?
So I don't know if you remember, but in the presentation, I stated that that's one of the reasons you want to make sure that you're using that list of verbs, because those are the action words that they're looking for first, right? And then the second thing would be the field specific language. So for medical billing and coding, there is a lot of terminology in that field. So I just put some on the presentation, but be sure to just research and look it up. If you are just not sure and you're just thinking to yourself, I don't know how I'm going to create those bullets, remember the formula that I use, and then be sure to go to onetonline.org. And then you could put medical billing in or medical coding. And that website right there is phenomenal for doing research. I'm going to actually put it in the chat feature right now.
Right.
Okay. So that's one of the things that you could do. I'm sorry. Did you ask me the second question?
No, that's great. Thank you. I was probably dealing with an email when I didn't hear all of it. I'm
That's
sorry.
okay.
But the other thing was, many of our students on this call are associates with Amazon, correct? I think.
Yeah,
Okay,
that's
so
I
that
was told
means,
that they were
yes,
the most.
yeah, so I heard during your presentation on the cover letters, how you can mention how detailed you are. I know Amazon associates are on it because I'm an Amazon customer.
Okay,
And I think sometimes we undersell ourselves with what we do.
absolutely.
You know, I mean, you guys cannot make mistakes on those packages if you're doing that or sorting or
Yep.
billing or whatever. So those skills are transferable, like Ms. Dunlap mentioned. You got to just sit
Yes.
back and see how can you put those in there. And everybody knows Amazon, you
Mhm.
know, which to me, that's a big plus when you are throwing, I
And
am
remember,
associate.
you can actually put on the resume if you choose to, like, if you don't want to take the chance that they don't catch the skill sets there, you can actually, if you have the room, you can implement it on your resume. You can put detail oriented and then put all the bullets that fall up under that you've done in that organization. And I can help you do that. That's not a problem at all.
Great, great. The other little thing, and I'm be quiet.
Mhm.
I've known this to help me in my career paths, and I've get leads. Like you all will be getting leads. And by the way, I am your expert that's going to be finding you these externships and internships. I'm going to be the guy, and I'm counting on you all to do your best so the way, because I'm going to be bragging. As they say on the street, I'm going to be throwing down how sharp these candidates are.
Okay.
And I don't want you all, I know you won't let me and Miss Dunlap down and Miss Brown. I know you won't. I just know you won't. So I've used this like when I'm applying for a position. I was recommended by Miss Wilson, who is an employee, blah, 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 blah. That has gotten, and that might get you an in. So it just depends though.
Mhm.
And that's all I want to say. And thank you again, Ms. Dunlap. I
No,
really
not a
appreciate it.
problem. So if I could just add to that, if you don't mind.
Not at all.
I know that I'm going to be doing another presentation um, towards the end of November. And
Right.
in that presentation, we're going to actually talk about that job search process. So if you know you are concerned about that, don't get anxious. Just show up, and I'm going to give you some information to help you with what your next steps should be. And now that I know that Mr. Townsend is just like a voice for you guys, then I'm going to be working with him so that if you need that last minute review, whatever it is, however I'm able to help you, I am willing to do that. I can't hear you. You turn your mic off.
The last thing, and I wanted to mention that maybe, you know what, maybe Miss Brown was going to mention the upcoming other workshops. So if you're okay and you're done, you want.
I am done. Thank you guys so much for having me. And I'm going to
Right.
turn the table over to you now.
Okay, all right. So before I open my mouth again, I want to ask Miss Brown, our career coach, are you up with your mic? Are you okay, Miss Brown? Gina? Hello, Gina.
Yes. Hi,
Yeah,
everybody.
great. Gina, take
Hi.
the floor. You want to share what's upcoming workshops going to be?
Yes, we do have quite a few upcoming workshops that are coming up on our agenda. I did send out a reminder email to all of our participants and clients. However, I will provide the upcoming workshops once again. We have a workshop specifically for our CMA, our clinical medical assistant students, which is resume workshop. And that is going to be on Monday, November 7th at 6 p.m. It will be virtual as well. And we have a workshop for both our CMA and our MBC students, or clients rather, and that will be on Wednesday, November 9th from 4 to 5. And it will be discussing how to secure an externship. I do know everyone is in these trainings and trying to have these opportunities for self-improvement and to make themselves employable. So that externship is really going to be the next step to get you secured in your field and to get you employed. We have our final workshop of this series for both our CMA and MBC students, and that will be on Monday, November 21st from 6 to 7 p.m. And this will be in relation to applying for jobs as a new clinical medical assistant and medical billing encoder. And this here is just going to be another step further. And once you secure that externship, maybe you didn't want to stay at that particular externship site and you want to transition and move somewhere else. This right here, this workshop will definitely be a good stepping stone and a tool to use in order to get you to apply for these jobs and to get your foot really in the door and to be able to be a recognizable force in this industry. Is there anything else you wanted me to discuss, Dr. Townsend?
I think that's it, but I almost said ladies and gents. Well, I am, anyway, so look, the voice that you heard, Miss Brown, is super professional, and that's how she is as your career coach. I just want to give her a shout out because I know she's not going to be there, brag about herself, but I am going to brag about her. That's the kind of professional career success coach that you have. So feel free to reach out to her anytime. I'm going to be, and I am beating the streets, and that's for real. I mean, everything is not email and telephone. I have to actually get in folks' FaceTime. I was out last week and people are excited about new people wanting to work. So everything that you've gotten tonight and you're getting in the future, these workshops, they're going to be a tremendous plus to you. So again, I thank you all for coming. I know we had initially 16 registered, but I think we ended up having, what, about 7, I think. But we're not going to worry about the numbers. You know, we know that everything begins in small steps and leads to bigger things. Most important thing is that you are here and you took the time out of your busy schedule. And those are the words I was going to share with you. We have about 60 days left before 2023. And if you go, well, so what? Well, I'm the kind of believer that if you really want to win in the new upcoming year, it starts today. It starts today. So it's about you and what you do in the 60 days. So you talk about your career plans, your goals. It requires about 4 things. One is commitment. I can applaud you all so much for being committed to be on this call today. So commitment, determination, correct action. We often hear the time, take action, take action. You want to say specifically the correct action is what you want to take. And you got all of us on your team helping you out. And the last word is victory. That's what you want. You want to be blazing in 2023 victorious, you know, that you got a good job, you got things coming. So I just want to say that and thank you so much. And I'm going to be out here looking out for you and getting what you want in terms of an externship and an extra internship or a placement opportunity, which will lead to a job. It's what we want to happen. So again, thank you so much. That's all I have to say. I want to say thank you, Ms. Dunlap, for an outstanding presentation. So I don't have anything else. Is there anyone else got anything else to say or share? If not, I have 7:02. So I was almost going to go. Do we have a motion to end this
Hey,
workshop?
Michael.
Yes, go ahead.
Someone in the chat feature is asking for you to put your email information in there.
Sure, I'll do that in a moment. Let's see here. Okay, what I'll do is I will put that in the chat for you. Okay, and if not, if you could, well, you might be driving. I hope you're not driving, but it's mtownsend4@govst.edu. So we all got the same GSU names, but I was going to add it in here. There you go. It's there. Thank you. Thank you, Ms. Tina. Thank you so much. So any other comments or concerns? If not, you all continue to work hard and be positive. And it's 7:03. So I'm going to say that we can adjourn this workshop until next time, November 7th, correct?
All right. Good night.
All right. Good night, everyone. Thank you for tuning in.